Health authorities in Kebbi State are intensifying efforts to contain a suspected outbreak of cerebrospinal meningitis across 4 local government areas. With 26 reported deaths and over 248 suspected cases, the state government is collaborating with key health agencies to mitigate the spread.
The Kebbi State government has swiftly responded to the situation by working with the World Health Organization, Médecins Sans Frontières, and UNICEF to contain the disease. Reports indicate that 26 deaths have been recorded, suspected to be caused by cerebrospinal meningitis, with 15 in Gwandu, 6 in Jega, 4 in Alero, and 1 in Argungu. Governor Nasir Idris has approved the release of 30 million naira to procure drugs and other medical supplies for affected communities. State Commissioner for Health, Comrade Yunusa Musa Ismail, confirmed that 248 suspected cases have been documented so far. He also stated that 11 samples have been sent to the National Reference Laboratory in Abuja for testing. While 2 samples have tested negative, results for the remaining 9 are still pending.
It is with great honor and deep sense of responsibility that I stand before you today at press briefing release on suspected outbreak of cerebral meningitis affecting 3 local governments of Kebbi State, that is Aleru, Gwandu, and Jega. 11 samples was taken and sent to National Reference Laboratory Abuja for confirmation.
In response to the crisis, the state government has carried out advocacy visits to key stakeholders in the affected areas, distributed essential drugs and medical supplies, conducted outbreak investigations to track the spread of the disease, and trained healthcare workers on proper sample collection with support from the WHO. Permanent Secretary for Health, Dr. Shehu Nuhu, said additional test results are still awaited to confirm the outbreak. He assured the public that if any of the pending samples tests positive for meningitis, the state will request immediate vaccine deployment from the federal government to prevent further infections.
Took 11 samples, 2 are back negative. We are still awaiting 9. So that if we get any confirmation out of this pending and the ones that we are still also taking and sending, then we will now declare that there is an outbreak of cerebrospinal meningitis in Kebbi State, and will add other specific interventions like the vaccination, as the Honorable Commissioner has mentioned.
The Commissioner for Health urged residents to remain calm but vigilant. He emphasized the importance of avoiding overcrowded sleeping spaces, maintaining personal hygiene, washing hands regularly with soap and water, avoiding unnecessary visits to isolation centers, and probably washing fruits and vegetables before consumption.
Distinguished citizens of Kebbi State, I am calling to every one of you. 1. When people felt sick, should immediately report to the nearest health facility, not remain at home. 2. To avoid sleeping in overcrowding rooms. 3. To minimize proper personal hygiene.
The Kebbi State government has reaffirmed its commitment to protecting public health and responding swiftly to disease outbreaks. Residents are encouraged to cooperate with health officials and report any suspicious symptoms to the nearest health facility. From Birnin Kebbi, Cynthia Yongu, Trust TV.